war on cancer has evolved sequentially over these years, and we started out with the bulwarks, the three major modalities of chemotherapy, radiation therapy, and surgery. And for a long time, that's what we have. But in the modern age, we've really come to recognize that we can have really targeted interventions. Carl mentioned rituximab, antibodies to CD20. There are actually other types of molecules, small molecules that penetrate cells and sniff out the genetic lesion in that cancer cell so that they can actually switch off that cancer cell or target that cancer cell to die. And those are known as these sort of targeted therapies, and terrific work has been done there. The third rung down is really almost where we are today, and the fourth is what's coming right around the corner, and that's this world of immunotherapy. And that's why you're here today, to hear a little about it, because you want to know what the future is going to bring you. And it's essentially this world of immune-based therapy and then combining gene and immune-based therapy to really make a potent product. And so if we return to the concept of transplantation, but in this case, we're doing a transplant from me into me. So this isn't from my donor, this gentleman in the front row, say, where he would be my donor. This would be from me into me, and that would be called an autologous transplantation as opposed to an allogeneic transplantation. If you do an autologous transplantation, there's no chance of graft versus host disease. I don't have autoimmune disease. If I take my T cells out and I tickle them in the laboratory and return them to me, they're not going to cause graft versus host disease because they have the same category, they have the same repertoire of T cell receptors that they had 10 minutes ago as when I drew the blood. And we actually thought of a different approach, where we didn't have to use viruses to genetically reprogram T cells, and actually we use fish biology, believe it or not. And this is something that actually got invented by a gentleman at the University of Minnesota, but we recognized that this could actually have human application. So we use bits of fish DNA to reprogram human T cells. And then there are other tricks that we learned, and in fact we learned them from Carl. And again, it shows you the power of cooperating and pulling together, where we learned how to grow these cells on these artificial antigen-presenting cells. Unlike the beads that Carl invented, we use cells as nurse cells that can tickle T cells to grow in an environment and grow them up.